as we have discussed the preparation methodology of seedless powder, it is also important to mention the right instruction on the label to the patient. So whenever we talk about the instruction on the label, the powder number 1 packet and powder number 2 packet, since they are dispensed together, the storage and direction are very important to be precise on the label. First and foremost, whenever we recommend about the storage conditions, it is important to mention that as the ingredients are hygroscopic in nature, this particular preparation should be stored in a cool place, and cool place generally reflects temperature of 25 degrees. So neither it should be refrigerated nor it should be kept in a hot climate, rather the storage should be appropriate in a cool place. And also the recommendation for this seedless preparation should be to be used within 2 weeks of dispensing or 2 weeks of preparation. And as advised that since we are packing in 2 different color packets, the direction should be that add 1 packet each of the powder in a tumbler of warm water, and the liquid is supposed to be drunk while it shows effervescence or drink while effervescing. And this is the reason why it gives a psychological impact, a good taste and also a therapeutic benefit to the patient. Now, since we have discussed bulk powders for internal use, our next categorization to be discussed is bulk powders for external use. So, as the name itself indicates, these are the preparations which are in powder form and they are to be used externally, that is on the body's surface area. So, here the classical type which has to be understood is dusting powders. Now, dusting powders are generally topical preparations. Now, dusting powders, as the name indicates, they are external use preparations, and when we say dusting, it means it should be dusted. It should not be dabbed on the skin, it should be rather dusted from a distance. And especially it is very important to note that dusting powders have to be dusted on intact skin. So, the skin should not be damaged, skin should not be broken, and it should be only dusted from a distance from the body surface. Under external bulk powders, apart from dusting type, we have second category which we call it as insufflations. Now, insufflations these are the powders which are in very fine state of subdivision, that is they are very fine to touch and they are intended to be introduced into body cavities. Now, different body cavities wherein insufflations can be introduced are ears, nose, vagina or throat. But generally, we correlate insufflations with nose application. Under bulk powders for external use, we have other types also apart from dusting powders and insufflations. We have douch. Now, douch is something which is to be applied in a vaginal cavity, but after dissolving it in warm water. So, these are bulk preparations. We also study douch under monophasic liquid type, wherein one dose is administered in one container. That is, one bottle will have a dose of approximately 50 ml. But when we take it under external use powders, douch, and if it is in powder form, it is to be reconstituted in warm water and then it is to be introduced into the vaginal cavity. Then we have the fourth categorization of bulk powders for external use, which we call it as dentrifiers. Now, dentrifiers are dental preparations. Now, dentrifiers basically are for teeth hygiene basically and cleaning purpose. So, these are composed of abrasive agents. Abrasion is important to clean debris from the tooth, and surfactants which helps to form lather and to clean and polish the teeth. So, they are coming under dentrifiers. So, let us discuss external powders bulk one by one. So, under it, the first type being dusting powders. Now, as already specified that these are nothing but powder dosage forms which are intended for external use. Now, when we talk about dusting powders, they are supposed to be dusted on the body, especially on the skin surface. So, since the body is covered externally by skin, they are recommended to be used on skin. There are two types of subdivisions under dusting powders, the first one being called as medicated dusting powder and the second being called as surgical dusting powder. irrespective of the type of dusting powder, whenever we talk about dusting powder, it is very important to mention a condition on the label as an auxiliary label for external use only. These kind of powders are not to be taken internally, and they are exclusively and explicitly maintained for external use. So it is very important to mention an auxiliary condition on the label. Now, since we are talking about medicated type and surgical type, now as the name indicates, medicated, that means it is for a medicinal purpose, and surgical, that is mainly after a surgery. So medicated dusting powders, one condition to be remembered is these are not to be applied on broken skin, because broken skin is already damaged skin and it is vulnerable. So when such a skin is open to bacterial infections, it is wise that we are not, because these kind of powders may get clogged or it may chap on the skin, because there might be some liquid exudate coming out of the broken skin, and when these powders are dusted, it may form flakes, and then it may cause more discomfort on broken skin. That is the recommendation, that medicated dusting powders should not be applied on broken skin. Now, in order to understand more clearly about medicated dusting powders, it is important to know its prerequisites. Very importantly, these are intended to be applied on intact skin. So I just mentioned the condition of warning not on broken skin, but otherwise on the contradiction, it is recommended on intact skin. Now, the purpose why we recommend medicated dusting powder is either due to its absorptive nature, that is, there is a wound from which pus or fluid is coming out, you want to dry the surface, so doctor generally recommends medicated dusting powder, which is generally dusted on the surface or at the site where there is exudate or the liquid coming out of the wound. So it helps in absorptive properties. Second reason why we recommend is astringent. Now, whenever there is precipitation of proteins, that is called as astringent property. So we have a cut on the skin. These powders are dusted so that it helps in healing, because the skin heals naturally and the protein present in the skin, when it precipitates, it bridges the gap which is occurring due to the cut. So that is the reason it is meant for astringent purpose. Then we also have protective action. Maybe our skin is sensitive, prone to bacterial attack, or climatic change also will have an influence on the skin. So sometimes medicated dusting powders have no other purpose apart from giving a protection layer on the skin. That's why recommended to be a protective. And lubricant properties, especially in winters, the skin ends up being dry. So maybe at times the medicated dusting powders are recommended that it leaves a layer of lubrication on the surface. These powders are recommended to be applied topically, that is on the skin externally. The additives which facilitate are generally added in such preparations, because the additives, when they are selected, the main purpose of selecting other ingredients apart from the drug is mainly which helps in ease of application, because these kind of powders have to be sifted, they have to be thrown out of the container by dusting. So when we are sprinkling it on the skin, the powder has to have good flow property, otherwise it will not come out easily from the container. Now here I can give you one example of talcum powders. You must have been applying talcum powders on the body surface. Similarly, dusting powders are applied on skins which has a property of either due to its absorption, astringent, protective or lubricant property. So additive selection or the ingredients which are added in the formula apart from the drug is very important here, because that will facilitate how good the preparation is coming out of the bottle. The general additives which can be considered are, we assume that we are preparing a dusting powder, what should come to one's mind? So first is, should I add an astringent? Now astringent, when I decide, whenever I am intending this preparation to be applied on a cut or a wound, my first intention should be that I should take some examples of astringent holding property drugs like zinc oxide or zinc sulfate. So my formula should have either zinc oxide or zinc sulfate because of astringent nature. If the formulation is intended for counter irritant property, sometimes you may get irritation. For example, you have an infection on the skin, you apply a product which will itself cause some more irritation, but after some time the irritation completely disappears. Such compounds are called as counter irritants. They induce irritation and they overcome the irritation. That is why we call them as counter irritants. Most important example under counter irritants is volatile oils. Now volatile oils, for example, eucalyptus oil. When you apply on skin, initially you may find slight itching or slight kind of irritation, but after some time the eucalyptus oil leaves no kind of feeling on the skin apart from its aroma. So these are counter irritants. Then we have also ingredients which can be considered adsorbents. Now we want the drug to be behaving in such a way that it takes out all the liquid exudate of the wound. Then the choice can be either starch or kaolin. We want that the powder should remain on the skin for long. So skin adherence, that is, it should have a property where it can stay on skin for longer time. Then the ingredients to be considered is aluminum stearate, magnesium stearate, zinc oxide and zinc stearate. Any one can be chosen in the formula. We want to have good glidant property, or we call it as slip property. It should come out of the container easily. So for that, the best example is either talc can be taken and zinc stearate. Now talcum powder, what we use for cosmetic purpose, is just plain talc. It has no other use. It has only one absorbent, that is either starch or kaolin, perfumed and having talc for good flow property, which we generally use for soaking our excessive perspiration or sweat. Now one classical example or prescription example which we can take up under medicated dusting powder is of the prescription called as zinc starch dusting powder. This is again an official product in National Formulary of India, having zinc oxide 25 grams and starch powder 25 grams. As already discussed the examples in my previous slide about additives, so zinc oxide is an astringent and starch is an adsorbent. So this formula has two ingredients, one meant to be astringent and other one helping with absorbing properties. So here we say that this powder is recommended whenever we want astringent, antiseptic and soothing property. So whenever a patient has a wound wherein it is having pus or liquid exudate coming out, then this powder can be recommended by the physician or the doctor in order to help out the patient cure or heal his wound. The procedure to prepare such a prescription having two ingredients is very simple. Both the ingredients should be individually size reduced and they should be sieved using sieve number 85. Higher the number of the sieve, porosity will be finer. So powder will be much finer because already the wound is the area on which this powder is to be applied. So if the powder is gritty, it may cause discomfort. The powder should be very fine when this is to be sprinkled. And then they have to be mixed, the ingredients after sieving have to be mixed in geometrical progression, which we call it as doubling method. Now since here the quantities are same, they are just picked and mixed together in a mortar and pestle, and then the final powder is sifted to have uniformity in particle size. Once the formula is followed and it is prepared, then the packet or the container has to be considered in which the powder is to be packed. Screw cap bottle or colored glass or plastic jars can be taken, having, important here is perforated lid. The cap having perforated lid, or it is called as the cap having small openings from which the powder can flow out. Here we are not supposed to open the screw cap, rather we just have to open the lid, and from the perforations on the lid the powder is sprinkled. So this is one example of medicated dusting powder. Now once the product is prepared, the condition of storage is very important, that it should be again recommended to be stored in a cool place, and already mentioned that this comes under dusting powder, medicated type, which is bulk powder for external use, the label should have for external use only. So it is very important that we mention the auxiliary condition of for external use only. Talking about the second type of dusting powder is surgical dusting powder. Now the name itself indicates surgical, so it is to be used after surgery. So mainly it is for treatment of either wounds, burns or broken skin. Now very important here is these kind of preparation should be sterile. It was not required for the previous type to be sterile, but in case of surgical preparations or surgical dusting powder, the property is very important that the powder should be sterile. This is because after surgery already the tendency of bacterial attack is high, and we cannot take risk wherein a non-sterile product is applied on the surface which is already vulnerable to bacterial attack. So that is the reason it should be made sterile. Now whenever we have to take the product and sterilize it, the container of packing becomes very important. So the next requirement for surgical dusting powder is to pack them in heat resistant either paper envelopes if you are making it in divided forms, and if you are packing it in bulk forms, we will consider plastic bottles having perforations or nozzles, so that the product when it is packed, it should be taken in its final container for sterilization, and the process of sterilization should not damage the container, and then the product is to be used as and when required and its sterility would be maintained. Now this is regarding dusting powders. So we have discussed dusting powders and types of dusting powders, that is medicated and surgical type. Now talking about the next kind of formulations which are under bulk powders for external use, we have insufflations. Now insufflations, whenever we speak about, the first kind of mindset comes is that these are nasal preparations. Because other than nose, any other body cavity, if we talk about insertion of powders, then we have different terminologies to identify such preparations. So here now, since we are talking about in general insufflations, now insufflations, the first important requirement to remember is these are fine powders, very fine powders which are intended to be introduced into the body cavity. So this is the first introductory line to be remembered, that they have to be introduced into the body cavities. Body cavity can be an ear, nose, vagina or a throat. As I just mentioned, most preferably it is recommended for nasal administration. Now I will just give an example here of inhalers. You have seen in the market inhalers which are supplied by Cipla company. Now if you happen to open the packing and view, it is very, very fine powder dosage which is introduced through nostrils or the nasal pathway, because it helps to relieve congestion. So in asthmatic attack, it really helps to open up the bronchioles and help in breathing. So on similar lines, we have insufflations, wherein you need an insufflator to introduce such powders in the body cavity. Now the ingredients which have to be incorporated in insufflations are generally volatile based. The reason of having volatile substances is that they will be able to have liquid property, and most important, they will leave a cooling sensation, and also it may be possible to introduce them deep into the lungs. So generally we say that insufflations have volatile substances and they are generally added into such preparations. As I just mentioned, in order to introduce an insufflation into a body cavity, we need an equipment which we call it as a insufflator. So such preparations are blown by insufflator into the nasal cavity, and these kind of preparations are generally meant for local effect, because in order to reach locally, it is very challenging through mouth if we are intending that local action be in the lungs. So this helps in local effect, and also nowadays the strategies are going beyond boundaries. Now the powder which is called as the insufflation is blown with air current. Now the air current which is developed is by means of an insufflator. Now this is the major difference between insufflator and an aerosol container. I mean to say, just imagine the perfume bottle. Now in perfume bottle, when you press the actuator, you have a fixed quantity of the preparation coming out in the form of a spray. Similar lines, we have an insufflator. Now insufflator, when we press the actuator of the insufflator, the air pressure which is inside the bottle, the air current will push the dose into the lung or the body cavity intended for. Nowadays aerosols have replaced them because we have a propellant kind of systems which are being used in today's time. So now insufflators popularity is little cut down and we have aerosol systems being very common in the market. Talking about the next type of powder which comes under bulk powder for external use. So just one revision from where we have started. We started about oral powders bulk, we completed, then we discussed external powders bulk. Under external powders bulk, we discussed dusting powders, we discussed insufflations. Now we are at the third stage, which we call it as douch or a douch as the pronunciation may be. So a douch, basically you may not find it being recommended in many books because this is mainly categorized under monophasic liquids. And douch is basically a powder formulation which is to be introduced only in vaginal cavity. Now whenever we have to introduce into vaginal cavity, it has to be in liquid form. So the powder dosage form which is prepared is dissolved in warm water. So as per the labeling requirements or the labeling instruction, water warm which is matching to the body temperature of 37 degrees centigrade, the powder is dissolved and the solution is then introduced into the vaginal cavity. Now generally the purpose of introducing such powders into vaginal cavity is either for antiseptic purpose, mainly to avoid any kind of infection especially after childbirth, that is normal delivery, or for cleansing purpose. And this is recommended to be used only in vagina. Then we also have other kind of drugs which can be introduced into such formulations. Apart from antiseptics, we can also have astringents, we can have deodorants mainly to deodorize, and the purpose of deodorants is for hygiene, vaginal hygiene, and the compounds which can be introduced into vagina may be methyl salicylate. We also have peppermint oil, thymol, menthol, eucalyptus oil, to some extent even at times alum, tannic acid and zinc sulfate. So we have many more examples, the main purpose being for deodorizing purpose. So we also have ready to use formulations as I mentioned into liquid form, and then they are generally correlated as douch. So many a times when a classification of douch is mentioned, it is important to not to get confused with respect to that why douch is being even spoken under powder dosage form. So it is one of the type of preparations which can be clubbed under external use bulk type. Then we have douch powders which have to be considered with one special recommendation of the pH. When we are dissolving it in warm water, the product's pH is to be critical. The pH of such resulting aqueous liquid, it should be in the range of 3.5 to 5, which is blending with the vaginal pH. Otherwise, the patient may end up with vaginal irritation. So it is very important that on reconstitution of douch powder, it is very important to monitor the pH of the preparation. The only limitation is of using special type of rubber syringe and nozzle which is to be supplied with such powders. Then we have the last type under bulk powders for external use, which we call them as dentifrice or tooth preparations. As I mentioned, they are mainly for dental hygiene, for cleansing and polishing of teeth. Thank you, and in my next upcoming series we will be taking up the next unit, as this completes our discussion on a powder dosage form. Thank you.